Good evening. This is from Bahrain Federation Labor Union. My name is Qada. I'm deputy of chairman of women, and this conducting we are a campaign of breast cancer awareness in October, and we have a pleasure to have this event here in Habib Bank with the collaborate of Al Hilal Bank and Dr. Mohammadi Sumaya Fatima. She will present for us about breast cancer awareness, and mostly it's like if you want to have a question, if you want to ask, it's up to you. Okay.
Bismillah ar-Rahman ar-Rahim. In the name of Allah, the most gracious and the merciful. I am Dr. Mohammadi Sumaya Fatima. I am specialist radiologist currently working at Al Hilal Medical Center in their Manama Central branch as a specialist radiologist. Today I am here to make you all guys aware regarding the very much important entity which is cancer, carcinoma of breast. In normal terms, we can call it as breast cancer. Here we are here in the month of October, which is celebrated internationally as a breast cancer awareness month. Why there is so much importance has been given to this particular entity? Because breast cancer nowadays, it has become the second most common cancer which has been affecting people worldwide. And it's not that it is just affecting the females, but it can occur in males also. So this is one very much important thing to be aware of. And since this we are here in October, we are celebrating it as Pink October, and the pink ribbon signifies the strength for our sufferers and also the battlers as well as the survivors who are right now the breast free. So this is dedicated to the survivors and those who are battling. See, the only person who can help you is you. So that is why it's very important for ourselves to be aware of this entity. The pink ribbon, as I told you, it signifies the strength, and it encourages all of us to make you all aware. So to start, I would like to give you a line that early detection is the key, because breast cancer per se, it is not always going to be symptomatic. So that is why we have to get a hold on it before it becomes symptomatic and before it progresses to further stages where the complications would come in very easily, and even after the best of the treatments, the prognosis might go down. So that's why here what we are trying to do is we are trying to detect it early before it becomes symptomatic. So that is why we have to run the screening programs. What does a screening program means? A screening program is not for a person who is willingly walking into the hospital out of some complaint. So you're not supposed to wait till you feel some kind of pain or some kind of lump in your breast or maybe the armpits. You are supposed to step up and come into the hospital to undergo screening when you feel you are absolutely fine. There is no problem with your body when you feel, because why? This signifies the importance of screening, because if you are undergoing constant screening protocols and if you are detected with a problem very early, then see, early detection means early action. So with proper treatments, we have got studies in which 64% of breast cancers who are diagnosed at a localized stage, that means at an early stage, they have got the 99% of 5-year survival rate. And in our community, among the people, there are so many myths and facts which are related to the breast cancer especially, which I'd like to bust today. So first of all, the first myth is the breast cancer only occurs at old age. No, age is no bar. We have been seeing patients right from as young as 12 years at the time of generally when the girls get the menarche, that is the very first period of their life. So age is no bar nowadays. All women are at the risk of CA breast equally, irrespective of age. Then secondly, there is they think that if only and only if we have got somebody in family, if there's family history, then only we are more prone to get. Definitely it is one of the risk factors, but then again, most of the patients what we come across, they generally don't have anybody who's affected with this entity in their family. there are a list of risk factors, out of which there are certain modifiable and non-modifiable. So people think that there's a certain category of patients who have got risk factors, they should only undergo the screening protocols. Again, it is there, but then it's not always the rule, because most of the patients who are diagnosed with CA breast are known to have no risk factors at all. And routine mammogram exposes us to the more radiations, because so many people think that to diagnose cancer of breast cancer, we are exposing you to the radiations again, because what X-ray is doing, X-ray is again a form of radiation only. So many people think that you are anyway exposing us to the radiation, making us more prone to have CA breast. So it is not like that, because the X-ray mammogram, the screening technique which I am going to talk about today, it's a very, very low dose X-ray radiation. So if you really see at the benefits of early detection of breast cancer, it far more outweighs this little bit of X-ray dose which we are going to expose the patient to for the screening purpose. Then we have among the females, some people think that wearing too tight clothing and can cause you cancer. No, it's not really like that. Then wearing different kinds of perfumes and deodorants, that will make you more prone to cancer, breast cancer. No, that has got effect on your skin, not the for the breast tissue. It is not like that. Then people think that it is always causes a palpable lump, that I told you. So many people have got this myth that breast cancer is contagious. That means it spreads from one person to another person by interacting or by talking or by sharing the certain common utilities kind of thing. It doesn't spread like that. Women with small breasts are free of the disease. They are not prone. This is also one myth. Then some people think once you're diagnosed with breast cancer, okay, that is the end of life. No, it is not like that. Certain people have got this mentality. Maybe they have seen somewhere, they have seen some or the other patient. Once they are diagnosed with this entity, the one of the whole breast has to be removed. No, it is not like that. Nowadays, with so much of advancement coming in the treatment protocols, it's not necessarily that you have to undergo the complete mastectomy every time. And one more myth, maybe you must have heard from someone who has already undergone the X-ray mammogram, the amount of pain. So many females are of the opinion, no, it is very, very painful. So anyways, I am asymptomatic, so I don't want to go through it. It is not like that. I know the technique which we use, it is little bit of uncomfortable. Some females might feel pain, some female might feel a little bit of pinching sensation. It's little bit of uncomfortable, but remember, it is tolerable. And this momentary pain will save you from a very, very dangerous entity like CA breast to progress to further stage before it get diagnosed. So as I was talking about risk factors, there are certain risk factors which are controllable and which are not controllable. The controllable comes, you have to maintain good physical activity, you have to maintain your weight in the given range according to your height and age. Then you have to have the reproductive history, because in reproductive history, females who breastfeed it is said that female who breastfeed their babies, it gives you a protective effect against breast cancer. So we should encourage breastfeeding anyway, because it has got n number of benefits in addition to, this is one of the this thing. And you have to stop alcohol consumption, stop smoking, and also this is very important, very, very irrational use of hormonal pills, may it be eye pills, may it be birth control pills, or maybe somebody is taking for any other gynecological conditions like PCOD, endometriosis, or anything. You have to use it very, very rationally. That means only and only under consultation with your gynecologist, not over the counter pills we should never take. And there are certain uncontrollable factors which we cannot do anything about that. Those are genetic genes, because there are certain genetic mutations in certain people. Those people are more prone. So that we cannot do anything for that. But what we can do, we can make such people undergo the screening protocols, and we can keep an extra amount of surveillance over those females, so that if at all they are going to get it, we can detect it at a very, very early stage and accordingly tailor the protocol of treatment for that particular person. Then menstrual history, then family history. Again, if you are very, very close relative, maybe the first degree like mother, first degree cousins, especially towards the maternal side, then again it's a risk, it becomes a risk factor. So sign and symptoms, as I told you, most of the times it is asymptomatic in the initial stages. That is why when the patient feels the lump and they enter our OPD, by that time they have already upgraded to the further stage. So most of the times some people might feel lump, some people might feel pain, some people might feel some kind of pinching sensation, some people might feel a little bit area is persistently thickened, or they are getting rash over that particular area. And some people might have changes in the size and shape of the breast, because some people have nipple distortion, there is change in the size and shape of the nipple. There could be ulcers which are not healing persistently. All these things, you know, it should prompt you to think about it and get yourself screened and get a consultation with your doctor. So to summarize, sometimes you can have nipple discharge also. Any kind of nipple discharge, may it be watery thing, may it be milk, may it be blood, may it be pus, you have to talk to your doctor, because any kind of nipple discharge other than the breastfeeding period is abnormal. May it be even milk if it is coming, but if you are not breastfeeding a baby, normally if you are in a non-lactating period, if you are getting, even that is abnormal. So you have to talk to your doctor. So guidelines for screening for people at risk, we have got these three tests basically: the clinical examination, self breast examination, clinical breast examination, and as a part of radiology we have got mammogram. So females between 25 to 39 years, they have to undergo self breast examination monthly, clinical examination yearly, and mammogram is not advised in any female who is less than 40 years of age. Any female who is more than 40 and above, they have to do self breast examination monthly, they have to undergo the clinical examination yearly, and also mammogram for any female who is more than 40 years of age. Here I would like to tell you the importance of self breast examination. You can, nowadays we have got Google calendars and everybody has got smartphone. Just put it in your calendar, may it be fortnightly or at least it has to be once in a month. Put an alarm, do it yourself. I'll tell you the basic points, but for you, you can anytime go to YouTube, put self breast examination. There are so many videos, informative videos, which will tell you the exact technique. Why? Because why I am emphasizing over it, breast basically it's a superficial, relatively mobile organ, and breast it's an organ. So if you hold it like this, you will always feel a lump. Understanding, ladies? If you hold it between your thumb and finger, you will always feel a lump, even in a normal breast, because of its consistency, because it's a gland. So to rule out any abnormality, you are supposed to palpate it with the flat of your fingers. So you're not supposed to hold it like this and examine. No, you have to palpate it with the flat of your fingers. Just remember this, okay? So to diagnose, we have different entities. By and large, mammogram means any investigation which is related to the breast. In mammogram, we have got X-ray mammogram, ultrasound mammogram, MRI mammogram. But as a part of screening, what we have is breast ultrasound mammogram. Self breast examination, I already told you. Do once a month, look in the mirror for any significant changes in the size and shape, because see, no two breasts will be asymmetrical, but everybody knows their own body. So if you find that it has become really abnormal as compared to the routine shape or the routine sizes, then you need to take note of it. And also remember this thing, breast examination is never complete without examining your axilla, that means the armpits. So once you are done with the self breast examination, you should also look the armpits for any kind of swellings, any kind of painful area which is, you know, really disturbing you. This is very important part when it comes to general population. Why don't women do this self breast examination, or why they don't want to undergo the screening protocols? Why? Because first of all, there is fear. If somebody is feeling some pain, First of all, they think if I go to doctor, if I get all this examination, then I might get diagnosed with breast cancer, which I don't want to accept. That's why let's just not just leave it. I just don't want to do it. Then a lot more amount of embarrassment, then taboo, stigmatization is associated with it in that society. So a female doesn't want to face that. So they just avoid the self-breast examination or the screening protocols. Then younger age females, then they think I am too young to get any kind of such dreaded diseases, so they just avoid. Then again, this is very important, which we are, there's lack of knowledge, social taboos. People think, oh my god, she is contagious, or then family members might think her family members are again at more risk factor for getting. So people, they don't comply so much with this kind of entities. That's why. Then certain females, they are too busy. You are too busy in your personal life or maybe professional life, so that you don't take care of your own health. So that should not be the case. And again, the negligence, even after knowing everything, just because I don't want to be labeled as a breast cancer patient or maybe something like that, see, that should not happen. Because we have seen cases where the people, females were abandoned by family just because they were diagnosed with some breast disease. It was not even cancer, because of these taboos and social misconceptions. And we have seen females also who have got lump, who are getting pain, they are getting symptoms, but they just out of fear of being diagnosed as a cancer patient, they just don't speak up. That is why I would like to say any breast lump is not cancer. Not every lump is a cancer, remember. So if you are feeling anything, you are feeling pain, small lump, big lump, anything, even if it's a big enough lump, it could be a benign disease also. Even if it's a small thing, it can be cancer also. So nothing is like that. So no taboos, fears and barriers are worth taking human life. So none of these fears which I already spoke, lack of financial resources. So many females think if the female doctor is not available, then I might don't want to get checked by a male patient because just the male patient is not available at particular that time point. Some people think that I will leave everything to the God, spiritual healing, I'll just go for. Of course, that is there at first and foremost point, but then again we have to get ourselves treated. Then any kind of hesitation, lack of social support, nothing is above human life. Human life is very, very, very precious. Then the treatment, today it's a screening program, so I won't go into the details of that, but the treatment part, I would say there are so many advancements which are coming up, so which will tailor your treatment protocol according to the patient's profile, which includes lifestyle modification to surgery, then radiotherapy, chemotherapy. We have got hormonal therapy for certain cases and targeted therapy. That is why I am telling it's not like previous. Once you are diagnosed with breast cancer, finish, the whole of the breast has to be removed. No, it's not like that. But then those are the cases which are diagnosed at a very later stage, because nowadays this entity has come up which is called as breast conservative surgery. In that case, according to that, they try to the max possible possibility to save the breast tissue as much as possible. So previously what used to happen, person first used to undergo the surgery and then they used to give chemotherapy. Now NSCT has come up, which is called as neoadjuvant chemotherapy, in which what they do is they give the chemotherapy before. So that if a 5 centimeter tumor is there, they'll try and shrink it to 2 centimeters. They'll downgrade it. They'll downgrade the tumor, so the staging also comes down, and then they remove the particular amount of tumor affected area only. So no need to remove the whole of the breast. Let your faith be bigger than your fear, and no amount of fear or social taboo or stigmatization associated with breast cancer should be above human life. This is the message. So according to as far as radiology is considered, I being a radiologist, I would advise all of you females, any female who's above 40 years of age, they should undergo annual screening. That means once a year you have to undergo the X-ray mammogram coupled with ultrasound mammogram, and then again, depending if any positive finding is seen, accordingly we'll tailor the further investigation protocol. So that's it from my side as of now. If you have any doubts or anything, please feel free to ask.